Good morning, good afternoon, good evening, wherever you are. I am Dr. Akwiasambang, and I just wanted to come on here and very briefly talk about pancreatic cancer, more specifically symptoms of pancreatic cancer. I'm here waiting for my train, and so it should be here in about a minute. And they're usually pretty on time when they say it's a minute. But anyway, I think the key message for today about pancreatic cancer is that in some people, it's an incidental diagnosis. What do I mean by incidental? It means that someone goes in, gets a scan of their abdomen for some other reason. Maybe the scan is to follow up a kidney issue, or maybe the scan is to follow up a liver issue. And then on that same scan, it's able to identify an abnormality within the pancreas that's concerning for pancreatic cancer. Sometimes people are getting a scan of their chest, and then that captures a little bit of the pancreas, and then they get referred for further evaluation, which might mean they get dedicated imaging, whether it's a CAT scan or an MRI of their abdomen. So it's very possible that some people are diagnosed with pancreatic cancer incidentally, meaning they're getting scanned for something else, and then the lesion is found on the pancreas. And I think, when that happens, it's definitely, heartbreaking. It might be a shock for some. The way we process our different medical issues varies from person to person. But I think one of the first things to understand is that, pancreatic cancer and cancer in general is not a death sentence. And when someone gets diagnosed, you might have so many questions. I usually tell my patients, write down all your questions, because sometimes you'll be in the doctor's office and you won't remember any of the questions that you had. But just write down your questions and ask your doctor all your questions. And so some of the ways this is processed is, the way we process this is, once you have an imaging that shows a possible mass, then you get dedicated imaging. Then you might get a procedure, an endoscopic procedure, to confirm the diagnosis. So the person who does a procedure gets a sample, they send it off to the pathologist who reviews it. And then you might get referred to a multidisciplinary team. So this is multiple doctors who will take care of you. And they discuss what the potential options are. They'll probably do something known as staging. Staging helps them determine how far or the extent of the disease process. So that was just a very, very brief explanation. So clearly it's been more than a minute since I was on here, but the train is coming. If you look behind me somewhere down there, I don't know if you could see, there is a train coming. But I really just wanted to come on here and just remind you that it is Pancreas Cancer Awareness Month. We'll talk about symptoms later, but for now it's just a reminder that in some people it's an incidental diagnosis, but it is not a death sentence. You'll have a multidisciplinary team of doctors taking care of you. Thank you.